We're going to go ahead and get started. My name is Dr. Sasha Thomason. I'm the Animal Facilities Inspection Program Director, and I appreciate you all taking the time to be here today for this webinar. For the next 60 minutes, we'll be focusing on controlling parasites in pet animal facilities. This is important to our KDA licensees because it's one of the most common pet animal disease control issues that any facility has to deal with. And, a lot of these parasites are zoonotic, so they can infect people as well. So there's a public health component to it. Before we get started, though, a few housekeeping items. During the presentation portion of this session, all participant microphones will be muted by the meeting host. So if you have a question during the presentation, submit it through the chat button that's at the bottom of your screen, and KDA staff will be monitoring that. We'll probably ask all those questions at the conclusion of the presentation. And then this session is being recorded and will be posted online for viewing next week if you want to watch it again, or for those that cannot participate right now. Without further ado, I'd like to introduce Dr. Naomi Hampton. She's originally from Cincinnati, Ohio. She received her bachelor's degree in wildlife sciences from Auburn University in 2019, and then pursued an education in veterinary medicine here at K-State's College of Vet Med. Along with earning her Doctor of Veterinary Medicine degree in 2023, she completed the KSU Shelter Medicine Veterinary Certificate, and now she's pursuing advanced training in shelter medicine as the current Shelter Medicine Intern at K-State. She enjoys all aspects of the shelter medicine in addition to dermatology and radiology. And so, Dr. Hampton, I'm going to turn it over to you.
Hi, everyone. As she said, I'm Dr. Naomi Hampton. I'm going to go ahead and give your presentation today. So give me just a second while I get the screen shared and we can go from there. Alrighty. All right, so today, as she was saying before, is just kind of controlling some common internal parasites of dogs and cats. And I'll just kind of go right on into it. And like she said, if you have any questions, feel free to put them in the chat and we can get to those after the presentation is over. I made sure to save time at the end for any questions you guys may have. All right, first one up is roundworms. So this is one of the most common worms in dogs and cats. And I'm sure many people have probably had animals with this. So these commonly affect both the intestines and the lungs due to their life cycle, which I'll describe more next. But what they do is once they're inside the intestines, they passively absorb the nutrients of the food that is ingested by the animal. So instead of the dog or the cat getting those nutrients, the worm gets it instead, which isn't great. For our main transmission methods, we have fecal oral, transmammary, so through nursing, and transplacental. And transplacental is actually just as important of a route of transmission as fecal oral. Studies have shown that about 95% of roundworm infections in puppies is due to transplacental transmission. So making sure that we treat the moms as well is very important. A little bit about the life cycle. This is just that we're all kind of on the same page. We kind of know where things occur and in what order. So first off, the animal is going to ingest the egg from either eating feces, which, it's not very cool, but they do that, or indirectly through a secondary host, such as a field mouse that becomes a carrier of the eggs. So they ingest that. It migrates through different organs and into the lungs, where it's then coughed up, goes through the trachea, and then they're swallowed. So that's how they go from the lungs to the intestines. Once they're in the small intestine, they'll mature into adults and passively absorb those nutrients from the food that the animal eats, and then they'll eventually start passing eggs in the feces, which kind of restarts the whole cycle there. So a little bit about signs is you're often not going to see any signs. When we think of roundworms, we typically think of the puppies that have that pot-bellied appearance. But if you have adult dogs with it, you may not see any signs. If you do, you can see some loose stool, or it can get to diarrhea. And since it goes both the lungs and intestines, they may be nauseous, may vomit, so you may or may not see any worms passed in the stool or vomitus. And that image on the right there is a picture of what roundworms look like. Of course, that one's through an endoscope, but they would generally look like that or parts of that in the feces if they are passed in the stool. So this one is zoonotic. There's two main pathways that it can be transmitted to humans. One is what's called visceral larva migrans, and basically this causes a variety of signs from diffuse, just kind of soreness, headaches, back pain. It causes a wide variety of signs. A more specific one is ocular larva migrans, where the worm migrates up to the eye, causes inflammation, and can cause permanent scarring of the retina and potentially blindness as well. So on the prevention side, this roundworms are easily treated with a broad spectrum dewormer. So treating on intake, whether that's you bringing the animal in, whether you have a litter of puppies that are born, things like that, making sure to treat them with a broad spectrum dewormer. One of those examples is pyrantel. So for deworming puppies, we were always taught in school 2, 4, 6, 8 pyrantel pamoate, which is the fancy name for it. And so for puppies, you can start at 2 weeks old, and then you repeat doses every 2 weeks for 4 doses. So at 2, 4, 6, and 8 weeks old. It's also very important to, if you have a pregnant female, after 6 weeks of pregnancy, you can give that dewormer to the pregnant female as well. That'll help decrease your chances for environmental contamination and transmission to the puppies during gestation. Besides the broad spectrum dewormers, you also have monthly preventatives like HeartGuard Plus, Interceptor Plus, things like that, that will act as a pulse dewormer. So they don't continually deworm throughout the entire month, but at the start when you give it, it acts as a pulse and it gets all the ones that are in the animal currently. That's why it's important to give them monthly, can keep up on that deworming. On the non-medical side, making sure to regularly pick up the feces. So roundworms, on average, with their life cycle, can take about 2 to 6 weeks for the eggs in the environment to develop to their infective stage, but it can happen as quickly as 1 week. And this is actually, of the ones that we're going to talk about today, this is probably the one that has the longest that it takes to become infective, but it can still happen pretty quickly. Oh, excuse me. So making sure to pick up that feces and then properly clean the environment. So making sure that we get all the poop off, picking up poop in the yards, things like that. And then since it can also be transmitted by the animal eating a rodent, things like that, making sure to prevent scavenging with rodent control so that that limits that transmission as well. Now, there are multiple different treatment protocols, different medications. These are just a few different names of ones. The ones that'll be best for your organization is going to be best figured out based off of working with your primary veterinarian with your situation, your population makeup, things like that. This is just a few different names of ones. So like you have like fenbendazole there, which the trade name of like Panicure, moxidectin and milbemycin oxime are in your preventatives. Pyrantel pamoate is that orange one that everyone says tastes like banana. I have not tasted it myself, but I will trust them with that. All right. So that was roundworms. The next one is hookworms. This one is also a very common worm, but especially in puppies. So over here on the right, you see a prevalence map from the Companion Animal Parasite Council for hookworms in dogs from last year. So the darker the orange color, the higher the infection risk. And these are speckles that were submitted to the lab. So this does not include any samples that were run in-house that didn't get sent in. So this is just the ones that were submitted to the lab. And as you can see, Kansas is in a pretty high risk, not the highest risk like the South, but it is a very, it is up there in its transmission risk. Hookworms generally affect the intestines, so they don't go to the lungs like the roundworms do, but they do have more means of transmission. They still have that fecal, oral, transmammary, transplacental, but they can also be transmitted through the skin, which I will talk about more with their life cycle. So for their hookworm's life cycle, the eggs are shed in the feces or passed to the young. And once they're in the environment, they are very hardy. They're able to last in soil for months. And so the animal would then eat the egg, lick contaminated soil, or the through the skin transmission is that the larvae, the worms, immature worms, are on the soil and they can burrow through the skin. Most commonly, you would see it in animals through the paw pads because that's what's in contact with the ground the majority of the time. So that's just another method of their transmission. Once they are ingested or inside the body, they get to the intestines and they attach themselves to the lining. So we can see that in that picture up there labeled C. They actually hook on, hence hookworms, hook onto the intestinal lining, feed, and then they start to lay the eggs and kind of restart that cycle that way. Since these hookworms do latch on and feed directly from like the intestinal cell lining, they can cause some blood loss. So you can see bloody diarrhea. Depending on the worm load, it can be very severe. And so with that blood loss, you can have pale mucous membranes. So gums really pale. They can be lethargic. They can be weak. This is due to them feeding and causing blood loss during it. So they get to have an anemia at that point. This one is also zoonotic, so like it can transmit and burrow into the skin in animals, it can also do that for humans. They call it cutaneous larva migrans, and it burrows into the skin of humans. And we'll talk more about preventing that in a minute. Just like roundworms, this one can be treated with your broad spectrum dewormers. Monthly preventatives, so still at the 2, 4, 6, 8 weeks for your puppies, and then after 6 weeks of gestation, you can deworm your pregnant females to help prevent your environmental contamination. For hookworms, regularly picking up the feces is also very important. So whereas roundworms were 2 to 6 weeks as quick as a week, the hookworms can actually, on average, take 2 to 9 days, but as quickly as like if you leave it till the next day, they can be infective. So at minimum, making sure to pick up the feces daily, ideally as soon as you see it. That way you have minimal environmental contamination. And then when picking up those feces, having proper PPE. So since they can burrow through skin, we want to make sure that we have proper footwear. So closed-toed shoes, wearing gloves, and then cleaning that environment. And then these do like to persist and be more common in areas that are warm or moist, and then they can be even worse. The situations can be worsened with overcrowding, poor sanitation, things like that. So it's important to pick up that feces at minimum daily, wearing gloves, closed-toed shoes, and properly cleaning your environment. So once again, different protocols. A few of the medications are the same. As you can see here, we have like Panicure, ivermectin, other ones that are within the monthly preventatives as well. But since these hookworms can cause blood loss, can cause anemia, it's also important to treat any concurrent flea infestations or other potential causes of anemia. So the fleas, they can bite, they draw blood, make sure to treat those so that those don't worsen, because we don't want these compounding on each other. The next one up is whipworms. Now, obviously, these are not quite as common as, sorry, I've put those in the wrong order there. Not quite as common as the others, but you do still see them. So these are worms that generally affect the large intestine and are transmitted fecal oral. So you can see signs like chronic watery diarrhea. You can also see bloody diarrhea, and then weight loss due to nutrient loss, fluid loss, things like that. For their life cycle, once again, the eggs are ingested, they reach the intestines, and they develop into adults. The adults will then lay the eggs, which are passed in the feces, and once these eggs are out in the environment, they are pretty resistant to heat and drying. So just leaving the concrete play yard or the grass area just to dry with the sun thinking it will get that won't work. It's not hot enough or dry enough really for that to happen. And then when they're in the environment, they mature to their infective stage, get eaten, start the whole thing again. So for prevention-wise, it's usually your monthly preventatives that are going to get this. The average dewormer, such as Pyrantel, that it gets used at intake is not effective for whipworms. So making sure to give monthly preventatives and in cleaning up the feces from the common areas and cleaning the environment is very, very important. That way you can limit the transmission, limit the environmental contamination as well. This one does have a few less treatment protocols. It's mainly fenbendazole or Drontal Plus. Once again, the best option for your population is going to be figured out by working with your primary veterinarian to see your population status, your environment, things like that. Just a second. Next up, we have tapeworms, which this one is a pretty common one that most people are aware of, but these worms affect the small intestine. And like roundworms, these ones will just passively absorb the nutrients from the food. So instead of the animal getting it, the worm gets it, which is counterproductive. And it's normally an oral transmission, which I'll talk about more with their life cycle. So for tapeworms, the proglottids contain eggs. So the proglottids are the end segments of the adult worms from the intestine. So they kind of shed chunks of the adult worms, and those portions have eggs in them, which are then passed through the feces. Once they're out in the environment, the flea larvae will eat those eggs. Once that flea matures, either the dog or cat will ingest the flea, or a small mammal, an intermediate host, ingests it, and then the dog or cat then eats the rodent. Either way, once that is inside, the larvae will migrate to the small intestine, they'll mature, and they'll just kind of repeat that segment there. So this is a picture of them on the right. They can look like, when they're shed in the feces, they can look like little rice grains, things like that. Or if you have a long string of them, they're very segmented. And so they're not normally going to see signs with them. They're often don't show any, but you may see some scooting, quote unquote scooting, or if you're looking at the feces or around the anal region or at the hair under the tail, you might see worms or small pieces of the worms there. If you have an increased worm load, the animal can have some abdominal discomfort, and depending on just how heavy that worm load gets, it can cause intestinal obstruction, just like foreign bodies can. And then these worms, tapeworms, are zoonotic to people as well. Your monthly preventatives can treat this, or prevent this, I should say, sorry. And then making sure to pick up the feces, properly clean the environment, and then rodent and rabbit control, make sure that your animals aren't eating those. So pretty similar to the ones that we've talked about so far. Treatment, it's a little bit different for the treatment-wise. There's a few, like fenbendazole, praziquantel, or epsiprantel. The fun thing with these is that usually the medication will only treat, or is only labeled for one species. So fenbendazole is labeled for one of the tapeworm species. Epsiprantel, which is the Cestex there in the corner, if you're giving the feline one, it gets one species. If you're giving the canine one, it gets a different species of tapeworms. So it's really important to work with your vet and either figure out what might be the most common in your region, or doing identification of those tapeworms to figure out which one would be most appropriate for your population at that point. And then, of course, since fleas are the main continuing element of the life cycle, making sure to treat and control for fleas both within and on the animal and in the environment as well. All right, so we're going to go ahead and move on to Giardia. So the previous ones I've talked about were all worms. Giardia is a protozoan, so you're not going to see any worms in the feces or things like that. So this generally affects the small intestine. And I will tell you that picture on the right is a very zoomed in picture on a fecal sample. Transmission is normally fecal oral. And the thing with Giardia is that you're commonly not going to see clinical disease. If you do see it, you're most commonly going to see it in animals that are highly stressed, or they are housed in large populations, large groups. So with their life cycle, the animal will ingest the cyst, which is basically like the eggs. The cyst is the eggs form for Giardia, whereas the eggs are for the worms. But the animal will ingest the cyst. Once ingested, they either by eating feces or just licking contaminated environment, the cysts exist, so they release what's called trophozoites, which are there on the picture on the right. And those will go into the small intestine, they'll replicate, and then once they are ready to be released back into the environment through the feces, they kind of encyst and form those cysts again that are released through the feces. One of the biggest differences with this one is when it's released into the environment, the worms have a certain time period until they are infective. Giardia, once it's released in the environment, is immediately infective to another animal. So if you have one animal that uses the restroom, another animal comes over 20 minutes later, it's infective to them as well. And then these are also very hardy. They survive very well in environments that are, especially ones that are damp. So like I said, often you're not going to see any signs of Giardia infections in the animals, but if you do, you can have acute diarrhea and it'll kind of look a little more mucousy, and can cause weight loss and dehydration because they can have such severe diarrhea that they get dehydrated as well. And since there are multiple different species of Giardia, the Giardia in animals is not normally like zoonotic to people, but if you have immunocompromised people or are immunocompromised yourself, there is the potential zoonosis there. So this one, the monthly preventatives do not cover it. So it is very, very important to pick up that feces as soon as possible and then properly clean and make sure the environment is dry. It's also important to reduce stress. So the Giardia will stay very well in the environment if you don't dry it. So it's important to, I'll get more to it on the treatment part, actually. If you have asymptomatic animals and say you have a fecal run and they see it on there, but they're not showing any signs, we generally don't treat those. But if they are showing signs, there's a few different protocols such as fenbendazole, metronidazole, or Drontal Plus. But one important part of this is to thoroughly bathe and thoroughly dry. So the Giardia likes to stick to the fur and around the anal region. So it's very common, especially for cats, to be reinfected just by grooming themselves. And then once they're bathed and thoroughly dried, to put them back into a thoroughly cleaned and dried environment. So properly cleaned and dried floors, walls if it's like kennels, things like that, having clean beds, litter boxes as well, bowls, toys, all of those sorts of things. All right, and then the last intestinal parasite is coccidiosis or coccidia. There are multiple different species. We just kind of group them all together and call them coccidia. Most commonly, you're only going to see signs in your young animals or if an animal is immunocompromised. For young animals, it can't be severe enough to be fatal, especially in young kittens. This is normally a fecal oral transmission as well, commonality with the others there. And then your signs are going to be diarrhea and dehydration, and diarrhea due to coccidia generally has a pretty distinctive smell. I don't really know how to describe it, but when you smell it, you're like, that's coccidia. But it can be severe enough diarrhea, dehydration leading to weight loss to be fatal in young kittens due to not being able to keep weight, being too dehydrated, things like that. So for their life cycle, once again, the animal's going to ingest it by eating the oocyst or licking the feces, the environment, things like that. They can also be infected by eating rodents that are carriers of coccidia. Once these are ingested, they reach the intestines, they mature, and these ones actually invade the intestinal cell linings, and they start up a cycle of infection. And then as they get going, they shed the oocysts and the feces, pass it to the young, and it kind of repeats that cycle there. This one, just like Giardia, your monthly preventatives won't cover coccidia. And very important to pick up the feces, clean the environment, have rodent control. And then because of their ability to persist in the environment, it's very common to have reinfection. This one has different treatment protocols than any of the other ones. It's also a limited number. There's like Albon, Panazeryl, kind of depends on your resources, your environment, things like that. Alrighty, so I'm going to go on to heartworm. So the previous ones that we talked about were all intestinal parasites, whether they be the worms, Giardia, coccidia. Heartworm is actually a bloodborne parasite that's caused by, is known as Dirofilaria immitis. And in order to be transmitted, this one requires mosquitoes, and more specifically, the mosquito to take a blood meal. And I'll talk about the life cycle on the next slide as well, but due to their life cycle and their development, there's not really any justification to test dogs that are less than 6 to 7 months old due to their life cycle. And so this is just one depiction of the heartworm life cycle. This one's from the Companion Animal Parasite Council. The American Heartworm Society also has different setups for their life cycle, but they're all very well depicted, very well described. But I'll just kind of go through a brief description of the heartworm life cycle. So you see it there at the top. The mosquito is going to bite a dog that is already infected. And when that mosquito takes the blood meal, it ingests the microfilaria that are in the blood. The mosquito flies away. The microfilaria mature in the mosquito's gut to be infective, and they move up to the mouth parts. And then once that mosquito bites another dog, the larvae are deposited into that area, and the microfilaria work their way into the bloodstream. So this stage is where your monthly preventatives are going to work. The microfilaria are what are treated and gotten rid of by your preventatives. Once it gets into the bloodstream, your microfilaria will kind of work their way towards the heart and the adjacent vessels. And then at that point, they'll start to mature into adults, and then they'll reproduce and create those microfilaria, which are what the mosquitoes then pick up. The whole process of them maturing to adults and starting to reproduce takes about 6 to 7 months. So this is why testing puppies that are younger than 6 to 7 months old, you may not pick it up, because even if they were bitten by a mosquito and infected on the day they were born, you're not going to have the tests are not going to detect those adults and the different microfilaria until they're 6 to 7 months old. So the adult stage is where your treatments are going to work. So normally your like injectables, things like that. So preventatives get the microfilaria, your treatments get the adults. So heartworm is another one where you're often not going to see any signs, any symptoms. Majority of animals that get diagnosed with heartworm disease either have very minimal signs or don't have any signs, and you find it on a heartworm test. But when they do start to show signs, they can start to fatigue easily. They can have exercise intolerance. They can start to cough, decreased appetite, and thus weight loss. And as they get more severe, they can have heart failure, and then that causes excess fluid to build up and cause abdominal distension. And then kind of the most severe part is cable syndrome as well. But more commonly, you're going to be asymptomatic, or you might see like a cough or exercise intolerance. So your prevention for this is the monthly preventatives. So HeartGuard Plus, Interceptor Plus, Sentinel Spectrum, Advantage Multi, which I will also touch on in the treatment section. Simparica Trio, those are just some of the preventatives that get heartworm. But if they do test positive for heartworm, there are a couple different protocols. The American Heartworm Society's protocol is the one that includes the injectable melarsoline, you have doxycycline, steroid of prednisone, exercise restriction, in addition to monthly preventatives. The other treatment protocol is the moxidoxy protocol. So it's moxidectin specifically in the form of Advantage Multi, and doxycycline along with your exercise restriction. So there's 2 different protocols, and the best protocol for you would be determined by working with your vet. seeing what your resources are and how you're able to go about treating them. But both of these treatment protocols include the monthly preventatives, which eliminates the microfilaria, which then ensures that that animal is not going to be infectious to another animal. Because when that monthly preventative kills the microfilaria, the mosquito can't pick it up and transmit it to another animal. So very important part is the monthly preventatives. All right, so this is just kind of a summary of the specific parasites today. These are just some of the most common. There are a lot of other ones out there, but the most common that you'll see are either roundworms or hookworms, whipworms, tapeworms, giardia, coccidia, and then heartworm, which is bloodborne, not intestinal. I'll go ahead and go on to just kind of a brief section about protocols of intake, cleaning, things like that. But honestly, the best protocol for you will be one that you have developed based off of your population, your environment, your resources, and working with your primary vet. So this is just kind of a brief sample of what might be in it. So on intake or birth, things like that, making sure to have appropriate vaccinations and boostering of those vaccines based on the age and species. So the most common ones for the dogs are going to be DA2PP, so distemper, adenovirus 2, parvovirus, parainfluenza, and bordetella. And then for cats, the most common one is FVRCP, so your feline herpes virus, calicivirus, and panleukopenia. It's also important to have that broad spectrum dewormer and your monthly preventative. So most commonly for dogs, that's going to be your heartworm, flea, and tick. And then for cats, flea and tick. Cats can get heartworm. It is just much less likely for it to happen, and they are harder to see signs and diagnose with heartworm. It's not as common. Just so that we're all on the same page before going and talking about different sanitation protocol things, just some definitions so that we're all on the same page there. Cleaning is the manual process of removing the dirt and organic debris, such as your feces, urine, things like that. Disinfecting is using the physical or chemical means to kill any pathogens that are still present after cleaning. And then sanitizing, eliminating as many infectious organisms through the combination of cleaning and disinfecting. And then sterilizing is like the top of the line, removing all microorganisms from any inanimate surfaces. This is what's done on like sterilizing surgery instruments, things like that. And it's not able to be done in kennel settings, and obviously it cannot be done on live animals or anything like that. So sanitation protocols have honestly a lot of different parts that you have to incorporate to think about with your environment and your resources. So making sure to choose the right product. Your right product is going to depend on what pathogen you're trying to get, the environment that you're in, and the time and staff that you're able to dedicate to it. So in terms of the correct pathogen, your disinfectants are going to get your viral and bacterial pathogens, which will not get your parasites. So that's where cleaning and decontamination is incredibly important for parasites like the ones we discussed earlier. But then disinfection is also important. So I'll still go ahead and talk about that, even though your disinfectants aren't necessarily going to treat the parasites, but it's good to have them both. They're needed. Excuse me. Making sure to use the right process. So having the correct dilution for the pathogen that you're trying to get, and then making sure that it sits on there, on that surface for the right amount of time. If you have organic debris on there before, and making sure to clean that off before applying the disinfectant, because a lot of the disinfectants are neutralized and become ineffective when they contact organic debris. Making sure to sanitize the right place. So often we think this is just, oh, we have to clean the kennel, but it can also be the people. So making sure that the people are not transmitting it between kennels, between areas, different equipment that are used. So making sure not to use the same rag for all of the kennels, their same mop, the correct surface, and whether you need to clean the animals as well. And then once you have the right product, making sure that you have the right dilution and process down, making sure to document a standard procedure or a standard operating procedure, SOPs, making sure to regularly review it, make sure that it's efficacious. If you start to have a breakout of something, go back and check your sanitation protocol, make sure that you're still using the right product, that you're using the right dilution, that it's the right contact time, and then updating those protocols as they go, as you develop and find new things that you need to change for it. This is a just the last little bit here, just one reference. This is a quick reference for shelter disinfectants from the ASPCA. There are other ones out there that are more detailed. This one is just a nice summary one. So this one, it tells you if they're for different viruses, ringworm, they have different dilutions. And then it tells you whether it's inactivated by the organic material, which then means that you have to have a cleaning step beforehand. What's also important is how long it's stable once you have created that dilution. And as you can see, there's different varieties here. You can have some that are only good for a day, some for a week, some for 90 days. So making sure that the product that you have that works for you either lasts long enough or that you only dilute a certain amount at a time. That way you're not wasting any resources and can make the most with what you have. It also tells you about contact time, whether you need to rinse it. This is one of the more succinct references. There are others that are a couple pages out there, but they're really easy to find. And so this one I know has the kind of the fancy names across the top. So your accelerated hydrogen peroxide, the normal names for that are like Excel or Rescue. The next one over, the potassium peroxymonosulfate. Surprised I didn't butcher that name. But that one's normally going to be like your trifectant or Virkon. Your quats are going to be things like Rocal, Parvosol, Kenalcare, sorry. And then your calcium hypochlorite is WYSIWASH. And then, of course, the last column there is just your kind of standard household bleach. Alrighty, and that's all I have for this. And I know we can have the questions in the chat. I will pass it over something for finding those.
Yeah, thank you, Dr. Hampton, for that. We do have multiple in the chat, so let's just bring that up here.
We do have some in the chat. If you want to stop sharing your screen, Dr. Hampton, that would be great. Wonderful. Thank you for everybody that put some questions in the chat. The first one that was asked is, what is the life cycle of whipworms once they are on the soil or in the ground?
So once they're they just kind of mature to their infective stage, they do have a variety of time lengths. I do not have the specific amount of time that it takes for them, but it is still important because they can to pick them up, the feces up as soon as possible, because they may also have roundworms or hookworms, things like that. So just making sure to pick it up, and then whether the whipworms have a couple of days, couple of weeks, as long as you're picking it up and cleaning the environment, that kind of negates how long it takes for them to be effective in the environment.
Okay, great. The next question that was asked was on detection. Can all of the worms that you mentioned in your presentation be detected in a stool sample, or just sometimes, or depending on the worm, et cetera? Can you expand on that, please?
Yeah, of course. So it kind of depends on what type of fecal sample you're doing. Most places will do like a centrifuged fecal, and depending on the process that's used for that, those can detect things like your roundworms, hooks, whipworms, some tapeworms, things like that. But and technically you can also see Giardia and Coccidia on there. Sometimes it's just harder to detect them on there. Giardia can be on the slide, can be very clear. So there is also a different method of doing fecals that are specific to Giardia. And that's also why Giardias actually have their own like a SNAP test as well, just because they are pretty difficult, especially in like a regular clinic setting. And so a lot of clinics that I've worked with before, that they have an animal that they have diagnosed with Giardia, they'll send out a recheck to the lab, because the lab is much more equipped and better trained to be able to detect Giardia, because it's a lot harder to see that one on a sample. But generally doing just a normal fecal sample, you'll see a majority of them.
Okay, well, great. This next one's a little long, so let's get this out here for everybody. So what do you find to be the best probiotic to heal the digestive system from all the worming of a puppy? The person that wrote in the chat said, I found that from all of the worming, the puppies go through a state of runny stools. What is best to heal their gut? This person hates sending them home with the runny stools, and also noted that they also bathe them once a week to help wash off any cyster eggs from the coat. So they'd really like to find out what you have for some suggestions on a probiotic.
Yeah, well, I love that you're giving them a bath to make sure that you're getting those cysts and the eggs off. That's very important, because I'm sure, as you've seen, they do reinfect themselves pretty easily as that, especially puppies who aren't the cleanest. For probiotics wise, I don't have like a specific one. I know there's ones like Fortiflora out there. I know also I've used Proviable a lot for kittens and for puppies. I've had to use it more so for kittens, mostly when I put them on like an antibiotic, and it seems to really help with their diarrhea. But just as long as you find one that is good, that works for your puppies, I don't have like a specific name or things like that. And then you can also just sometimes having a kind of more of like a bland diet, which kind of is hard for puppies at times, but having a bland diet with fiber can help reform their stool as well. So like I know sometimes I've used, for at least for kittens as well, just a little bit of pumpkin acts as a good fiber source, and they generally really love it. And so you can just give a tiny bit of pumpkin with their normal food, and that can help to firm up their stool as well.
Great. The next question that came in is, if an animal is positive with Giardia but asymptomatic, why don't they receive treatment if they're in a shelter environment, because they can spread it? Is that correct?
So they can still spread it. The thing with Giardia is, so when they're shedding their cysts, it's kind of in waves. So if you do a fecal or you do like a Giardia test, it may not always see it. Like it may not always get the signs, and usually you're going to see your signs in those that are more stressed. So if you're working in that shelter environment to decrease the stress of the animals, whether that be increased enrichment, outside time, having them in a quieter area, having if they're just really anxious as well, doing behavioral medications for a short period so that they can get acclimated to the area. They can still shed it, of course, but the other animals may already have it and just aren't showing signs, or they may not show signs because it's not affecting them enough, because their immune system is supported enough, they're not stressed, that's lowering their immune system, and so they don't show those signs. It's kind of like feline herpes virus for kittens. For cats, majority of cats are probably going to have it. They're only really going to show those signs when they're stressed, and that's when you do treatment. So doing treatment beforehand is not going to get rid of it. It's just keeping their environment healthy, keeping them healthy, so that they don't so that their body doesn't have to show those symptoms, kind of thing, if that makes any sense. Sorry.
Got it. We have one more that's in the chat. So if any of our participants have a question, go ahead and add that. This question is, once species has been expressed, what is the transmission for the variety of worms that you had talked about earlier in your presentation until the next dog can be infected? And then they follow up with, do you have any experience with dog coronavirus in a facility? Do you have some suggestions on protocols with transmission?
All right, so for and correct me if I'm wrong, I'm understanding from your question that for how long it takes for the the eggs to be infected in the environment for another animal to get infected. For that, it does vary. So like your roundworms can be as quick as a week to be infective, or it can be the 2 to 6 weeks. Your hookworms, it's 2 to 9 days. Whipworms have a wide variety. So it varies per worm, but that feces can have multiple worms in it. So there's no set amount of, oh, this dog has just whipworms, so I don't have to worry about it being infective for a certain amount of times, because often they'll have kind of a mixed population of infection with those worms. And that's why our monthly preventatives and our dewormers are great at getting multiple of those types of worms. So it kind of acts and gets all of them at once. And so making sure to pick up that feces daily at minimum, ideally as soon as possible, but we all know staffing time is not conducive all the time to just going immediately picking up the feces. So just if you know you have an animal that has worms, or you have a new animal that's coming in that may or may not have them, maybe being a little quicker to pick up the feces after those animals, but then at minimum for everyone and your common areas, and even in their own kennels, of picking up that feces daily at a minimum to just kind of help tamper and minimize that transmission and possibility of them becoming infective. And that's why having your protocols, are having a standardized procedure that's done each day for cleaning is one of the best ways to help prevent it. Because sometimes your dewormer doesn't get it because it's a pulse dewormer, and they may get it 2 weeks later if it's in the environment. And so then they don't have another dewormer until the next month. So making sure to have that monthly or the daily cleaning and picking up of feces is probably like the most important thing for it. In regards to the dog coronavirus, I specifically don't have an experience currently with the specific dog coronavirus, but with viral transmissions in general, making sure that you have adequate isolation areas, proper PPE when you're going in, and making sure that anything in the isolation area stays in there. So don't have storage for other sections, or bowls and toys for other animals in the isolation area. And then working with your veterinarian to develop a detection protocol, or like signs to look out for, how it can be transmitted, working with them looking at different disinfectants to see which one will get the pathogen that you're most worried about, and developing those will help to limit your incidence of those diseases. And I'm sure many veterinarians are more than willing to work with you to be able to develop these protocols. That way we can decrease the incidence of it happening in your facility.
Oh, great. Thank you. We had one more come in while you were answering those questions. Our participant wants to know, do you know if anyone has ever used a weed burner to heat up the cement flooring to help kill parasites, then follow this up with a bleach sanitizer to help prevent the spread of parasites?
I personally have not heard of that. I would not necessarily recommend it though. Especially if you have cement flooring inside, it's not the greatest, because then you can destroy the surface of your flooring as well. And as it gets more porous, it's not able to be cleaned and sanitized effectively. So just the protocol of cleaning up that feces, things like that, making sure to pick it up, clean it off, even if you have to like hose it off a little bit to get the stuck on stuff off, and then using the proper cleaner, whether that be bleach, whether it be Excel, Rescue, things like that. The cleaning part, picking up that feces, cleaning off the stuck on stuff, that'll help get your parasites, and then helping with the different disinfectant, whichever one works best for your facility and your resources will get your viral and bacterial. So I cannot recommend a weed burner, but just general cleaning of them.
Well, great. That's everything that we have in the chat. Dr. Thomason, I'll turn it over to you. Thank you.
Yeah. I just want to mention before we go that we do have previous talks like this recorded, and they're already on our website. There was one done probably a year ago now on different viruses and whatnot in dogs that Dr. Orchard, I believe, did. And so I'd recommend going back and viewing that one to get more information about like viruses and any bacterial questions you may have. But I hope everyone has a good day. We're thankful that you joined us for this. And I just want to say thank you again to Dr. Hampton for her time and her expertise and coming to share with us today. So thank you and goodbye.